Hi, I'm Dr. Jim Hoven, your host of the Difference Makers podcast. This is a place where people come together that are making a difference for those who want to make a difference. And that's you. We're bringing thought leaders together in a sense of fusion where ideas and concepts and personalities are all driven together into one place at one time. And this is no different. In this episode, you're going to see cool things from cool people making a difference. Hello, everyone. Dr. Jim Hoven here, your host of the Ramos Law Difference Makers podcast, and I am happy to say we are on remote today. So normally you see us in our studio. Now we had to come see this incredible place called Tepeyac Community Health Center. We're going to dive into what it does, but just in case you didn't remember, if we look way back on, I think it was like episode 156 or something like that, right, Gabe? Like 156, 159, look around there and you will find our original airing of a Tepeyac interview that we did with CEO Jim Garcia and how the vision came to be. So we won't spend a lot of time there today, but here's why we're here. We had gone to an event called Tortillas for Tepeyac. It was amazing. And Jim, as the CEO of this organization, invited Dr. Ramos to be one of the tortilla rollers. And there was a whole group of tortilla rollers, like a dozen of them or something. It was a fun time to raise money for this incredible group, this incredible cause basically of keeping healthcare in the community affordable and the highest level possible. So after that time, Jim and I met again. We hadn't seen each other for a little bit, and we decided that we needed to bring a light on where Tepeyac has come from the time that we last were with him up until today. So this is a really cool on assignment episode today. So Jim, welcome back to the show.
Good to be back, Jim.
I'll tell you what, this place is as advertised, man. I'm telling you, when the last time we met, I don't think it was open quite yet.
We were getting ready to open, I think, last time we talked.
Getting ready to open. And so I had the chance to take the tour, had the chance to go through all of this. And I'm telling you, what you guys have created here is nothing short of unfortunately, I've had to be in several hospitals over the last couple of years with unfortunate stuff. And what you see is the level of finish and the level of care and the spirit within these buildings. This rivals the best hospital that I've been in. It is incredible. So what you have done and led in your 12-year CEO career here is, there's something to be commended. Would you just share with us a little bit about what Tepeyac is, just the brief version? What's it about from its roots to how you guys got here?
Yeah, we started over 30 years. We celebrate 30 years this year, actually. It's our 30-year anniversary. And we started in this tiny little 110-year-old North Denver bungalow. But what was unique of our founding was that it was the community that came together and renovated this tiny little house, and we opened 30 plus years ago in this renovated 2-bedroom little casita, and opened it as a 2-exam room clinic where the porch was the waiting area. And I think what was unique about, when I think back where we started, is that we were in a home. And so that to me is probably the most important in terms of what we want to, the feeling that we want to convey to our patients is that we want them to feel as though they're an honored guest in our home. And so when we started the design for this beautiful new building, we told the architects that we wanted to create the opposite of what you would typically think in terms of a sterile clinical environment. We wanted to create a space where people felt welcome, they felt like their culture is being honored, and so what you see here is a lot of work that went into that original design in terms of what would make the patients feel comfortable, in terms of getting their healthcare needs met.
Yeah.
And so I feel really good that we've been able to achieve that.
Man, I'm telling you, Jim, mission accomplished. I was so moved as we were walking through the tour that you shared with me. One particular piece, and I want you to go through it because it speaks to from the roots, from the origin story that you guys have up to now, that there's a portrayal of a handful of people looking to basically a righteous figure, and they are looking at that in it, almost their expressions are looks of yes and help us, and we got a mission. We got, like, you could see it in the faces, and it's a 4 or 5 piece mural that goes across one of your walls. It's amazing. I got a picture of it that we'll post onto this podcast. But you are in the picture as one of the founding people. You're there, and it's just so amazing to me that heart from you were there 30 years ago to see this thing through, but not as the CEO. Then you had a whole different role. So you've grown up with this organization.
Very much so, and I was new to the community at the time, and so I think what was depicted there in that mural was not just me, but a whole community coming together, a group of leaders, community leaders, saying, we've listened to our community. We know that access to high quality, affordable healthcare is extremely important. And but at the time there was no big grant that we had to work with. We had zero budget, but it was the faith of the community. I think again that was depicted in that mural. We started through Our Lady Guadalupe Church in North Denver. At the time, it was very much a very progressive and socially conscious community, and so when the issue of affordable health care for people that were experiencing tremendous barriers to care came up, that resonated with me and a lot of other people, and they said, okay, what can we do as a community with very limited resources? We can bring people together that have tremendous talent, and let's renovate the little house and get started.
That's so cool. And man, have you guys ever kept that little house feeling here, from the colors, the style of the furniture? For those of you that have not been here, it's very relaxed. It's round couches. It's almost coffee room chairs. It's amazing. And people feel their families are here. You can see them. They're sitting and they're enjoying. While they may not be here for an enjoyable purpose, there's a comfort level. The colors, and it does culturally match the Latino Hispanic community, right? With a lot of the artwork and then the colors, it's absolutely fascinating. All the way down to the courtyard outside, which we went and hung out at for a little bit. It's like the yard. You mentioned people hanging out on the porch at the waiting room before. Now there's a backyard. Uh-huh. And not only is there a backyard, but there's a bedroom, a kitchen, a bathroom, because you guys also have units above the clinic that are affordable housing units that people can take advantage of. So now it's almost a self-contained what people would need for their life and their health.
Exactly, and that was very intentional. We when we were looking for a location to build, we were approached by an organization called the Urban Land Conservancy, and what they do is they acquire property in urban areas, and develop it for the community benefit. So they approached us, it was about 7 years ago when we were thinking about where we wanted to build our new facility, but they asked us to be the anchor organization for this much larger project that included affordable housing, access to fresh food, everything, like you said, that people need to live a healthy life. And so that really spoke to myself and to our board, that we could be part of something much bigger than just building a clinic. We wanted to be part of a very holistic approach to healthcare, and affordable housing, as we all know, is key in terms of a family's health and well-being.
And do you know how many people, and if I remember right, didn't you say there's 150?
150 apartments. So these are efficiencies, 1, 2, and 3 bedrooms. So lots of children, families live here as well.
Isn't that great? And
many of them are now Tepeyac patients, which is,
of course,
from a convenience standpoint, it doesn't get...
It means everything, because people will go to the doctor when if there's lower barriers to entry, you will have better compliance. I saw it in my practice, and we've seen it all across. And working with you guys now, the time we have, and working with other community health centers, the less the barrier to entry, you will get that. Because when people don't have money, don't have resources, don't have a car to get there, they won't take their medicines because they won't go fill them for any of those reasons. And you've solved them.
And that speaks to our pharmacy that
absolutely
we
game
opened.
changer.
So this was a key missing piece of the puzzle, is because in our previous location, we were providing excellent care, but when it came to their prescription needs, our providers would write the prescription and hope that their patient would fill the prescription. Now they complete their appointment, they have their prescription, they walk across the hall and fill that prescription. So from the point of view of adherence, it's just increased astronomically in terms of that.
Sure. Yeah, it's magnified tenfold for sure. What about the numbers? Tell us where this thing has been able to go so far with numbers that you were seeing, because you went from the house, then you grew into a 6,000 square foot clinic eventually, and now 3 to 4 times that.
You're almost 25,000 square feet.
So how does that translate into the number of people you're serving?
So we, at our previous location, we pretty much reached capacity at about 5,000 patients. This is 2024 is our first full year in this new building, and we're already approaching 10,000 patients. So we're close to doubling what we were able to do in our previous location, and we believe that we can go probably double that eventually. So within the next couple of years, I think we're planning to be at closer to 15,000 patients, and we can grow from there. We still have our other clinical facility that we in the Gloveville neighborhood, which is the neighborhood we're in here now is the Elyria neighborhood. So one neighborhood over is the Gloveville neighborhood, and we just renovated that building, so we can now grow back into that space. We're currently using it as a space for screening people who are seeking their asylum refugee status. So
wow,
these are.
I bet you're real full right now.
So these are our families from several different countries, including Cuba, Afghanistan, Ukraine, the Congo. So Tepeyac is truly becoming a multicultural organization.
Wow. Now, when you talk about 10,000 patients, is that 10,000 individual patients, or is that 10,000 visits?
Individual patients.
So if they come in 2 or 3 times, your visits are going
25,
way up.
30,000.
Yeah. So. Isn't that something that you can have that with how has this met or exceeded the expectations that you had for it now that it's been open going on a little over a year and a half? Have you noticed anything like, wow, this was something I didn't expect, or what a deal?
No, I think the volume that we're seeing is what we expected. You know, the whole adage of build it and they will come. You know, the people are definitely coming. The more they hear about this new beautiful facility that we have, word has gotten out. So we're definitely seeing just a steady increase in demand. So we still have plenty of room to grow, but we want to be keeping one eye on the future, as the mural depicted.
Yes, yes.
And you know, being prepared for additional growth opportunities as we continue to analyze the need that's out there in the community.
Speaking of growth opportunities, would you share with us the things that you were doing, the services? The service offering is amazing. You know, everything from your standard dental, I'll call it a mini urgent care or a low-level urgent care with then the resources to expand to mental health and even dentistry. Can you just go through the kind of the list of offerings that you guys have here? Because it's truly remarkable.
Yeah, probably the biggest, most dramatic increase in service is in the area of dental oral health. In our previous location, we had one small dental operatory, was barely enough to do just very, very basic oral health procedures, cleanings and such. Here at our new facility, we have a dental suite with 6 operatories, and so we have right now we have two dentists, 2 full-time dentists, and 4 dental assistants, so a full dental team. And so that the need for dental services is incredible, especially within the Latino community, especially within our recent immigrant population, where they haven't been receiving in some cases any kind of oral health care. And so to have that service and have it so significantly expanded has made a huge difference for our patients. And so again, we're trying to figure out how we can continue to expand our capacity in dental, but right now we have that. We've been able to increase it 5-fold just by virtue of moving into this facility. The other major increase in services is around mental health. In our other building, we had no dedicated therapy rooms. Here we have, as you saw, 5 traditional therapy rooms and also 1 area designated specifically for small children that have experienced mental health needs, some level of trauma, that we want to make sure that their needs are getting met. And so we have a room specifically designated for small children, where our therapists can provide art and play therapy.
Well, I got to see the room where the art and play therapy happens, and you can see how impressive it is. Again, the colors, the connection, and I could just imagine if a little one were going through something that they don't even know, they're just little, right? But if it says, hey, we need help, that room is so comfortable and so inviting and such a place for them to be able to make that deep connection to what it is that they need without even knowing they're needing it. They're getting it. And I was just really impressed with that piece.
Yeah, there's still a certain amount of stigma related to mental health care, especially within our Latino community. And so we wanted to create a space where we could reduce that level of anxiety and that's the stigma associated with receiving mental health care. And I think if parents see this space for their children that feels comfortable and feels like their needs are getting met, then I think they become even more comfortable getting their own mental health needs met.
Yes. And, speaking of that, I want to dive into your involvement in the community. As we were going through the dental suite, you showed me this cute little dragon, and the dragon was basically something that when you guys go out and you talk with the community, I'm interested to know your process of this. You show this little dragon and say, hey, this is like little Puff or whatever his name is, right? We want to keep his teeth clean, and it's a way to help foster oral health. What is your guys' message, or how do you get things like the importance of oral health, mental health, checkups? How are you guys doing that?
Yeah, the puppet is actually Elvis with the big
Elvis,
with the
of
big
course
teeth.
It is.
But again, we know that we need to get out in the community and be proactive in terms of addressing the preventive health or preventive oral health. So our dental team will go out into the elementary schools and provide that level of preventive oral health care with regard to sealants and just a full dental checkup, and then referral back to our dental clinic here as appropriate. But getting out in the community and providing that level of preventive care is extremely important. And it's always been a trademark of Tepeyac since we were founded 30 years ago, is getting out in the community and educating our community about what they can do from a preventive standpoint to improve their own health and the health of their family.
Beautiful. Do you guys do anything like that with the mental health side to give awareness that parents might think, I don't know if there's something going on with my child, and then they go, oh, well, I heard someone say something. Maybe that is something I need to bring them in for. How do people get into the mental health side?
Yeah, a lot of word of mouth, I would say, within our community. We do try to get our providers out when they're able to do actually something like this, where they can talk to a large audience about the importance of mental health. And so, but I think it's just an ongoing effort on our part to destigmatize getting mental health treatment. And so, I think creating opportunities for education, getting our providers out in the community when possible to provide that level of education.
Yeah, I tell you what, I don't know if you guys have thought about this, but the room that we're sitting in is beautiful. It would be a great community room, and I know that's what it's called. It would be a great educational place for you guys to invite the community and to learn about different topics that you guys
we actually do that with this space. Yeah, we let when we're not using it, we also let other community groups use this space. Matter of fact, one of the programs that we offer, apart from all the integrated medical, dental, and mental health, we provide every Friday. So tomorrow afternoon, we distribute fresh food boxes, so fresh produce, fresh vegetables, and fruit. So that is part of a structured program that we have where people sign up, especially people that are dealing with chronic disease, where they're someone who's a diabetic really needs to pay close attention to their diet and eat as much fresh produce as possible and prepare dishes that are healthy. So we have a new partnership with the American Heart Association. So they're going to be partnering with us on those Fridays that we do the distribution of the fresh produce boxes, and they'll come in and do healthy cooking demonstrations and how to some people don't know how to prepare fresh kohlrabi or whatever the case may be.
Right.
so that, to not just give a family a box of fresh produce, which is a great thing, but to actually demonstrate how they can cook a healthy meal.
That's so important. And to know what the possibilities are. What can you do with a set of 4 ingredients, let's say, and you can make 16 things or whatever the numbers would. That creativity becomes really important in so many areas of our life. I love that you guys are connecting now in other ways. I think that's just brilliant.
It just brings to mind the old adage again of teaching someone how to fish as opposed to just giving them. So we provide the food box, but we also tell them how to use it in a way that is going to ultimately improve your health.
Yeah, and that makes such a big difference. I know I'd never heard the term food desert until a few years ago. Mm-hmm. And I was like, what do you mean food desert? And they were talking about these densely populated places, but because the median income was so low, they couldn't afford vegetables, no less organic meats and fruits and vegetables. And so what would they rely on? There was plenty of gas station food. There was plenty of Hostess ding dongs and cupcakes around. So, but as far as a nutritional food, that was where the food desert was. And people, when they get, like all of us as humans, we get habituated into what we do, what we eat, how we think. And if that's what you're taking in all the time, pretty soon you think that's normal. And then when you feel like crap, you think that's normal too.
Yeah. Yeah, I would say that this area, this Gloveville, Elyria, Swansea neighborhood is historically been a food desert, and that's something that we're trying to address and contribute our expertise in that area. It's we're right next to the National Western Stock Show, which is being currently redeveloped. There's a plan to open eventually a fresh food market, so that will hopefully be part of the solution of addressing the food desert issue. But that's still several years away. So we, as an organization, we want to do what we can to make sure that our patients and the community as a whole has options for healthy food.
I love it. Can you describe your kind of average patient demographic? In other words, who is it that comes to Tepeyac? These 10,000 people, what do they look like? And the reason I want to ask you this question is to take it to a place where these folks aren't making $200,000 a year around here.
Oh no.
Right? And so, but yet they're getting this, what I'm going to call world-class care. And so then we're going to talk about how that happens and the importance of connecting with a place like yours to make this whole thing work.
Yeah. The majority of our patients are, I would say about 90% of our patients are Latino, although the demographic is starting to shift. I think more people hear about us. They want high quality care in a beautiful space. So the demographics are starting to shift to include other ethnic groups. But in terms of the other important component of who we serve, these are working families, families that are working sometimes 2 and 3 jobs to provide for their families. And a lot of times healthcare kind of takes a lower priority in terms of the needs that a family's experiencing. And so our goal was to make access to healthcare as easy as possible. For sure. And so because when you're working multiple jobs and trying to get to a doctor's appointment or trying to make a run to the pharmacy is not so easy. And so if we can help to mitigate that to some degree, then we feel like we're being successful at our mission.
And I know healthcare costs money. People are looking at their EOBs and seeing, it's $22 for an aspirin and it's, $100,000 for this surgery and all these kinds of things. You guys are not doing high level surgeries, but you're still involved in the process where people aren't having to pay that much because of why?
So we, that is an interesting part of the delivery of care because we're what's known as a community health center, also a federally qualified health center. So we are in a position where we can provide someone that comes to us with insurance. We accept all insurance, including Medicaid and Medicare. So almost every type of private insurance we accept here. But the majority of the people that we serve here are people who don't have access to insurance or not eligible for Medicaid or Medicare. So someone that comes to us without insurance, we have the ability to put them on a sliding scale, and they pay basically what they're able to pay. So our goal is to never turn anyone away based on their ability to pay.
And see, what makes that beautiful and where I want to take that is when I was in practice, in my chiropractic practice, one of my big things was healthcare. From what I did, from my scope of care, it should be a right, not a privilege. And so I would do my own thing to kind of create a plan like that for people. But there's so many, the system makes it very tough. If you have 2 fee schedules and if you have this, or there's all these things that make it tough. And you guys have had to find a way around that. And one of the big ways is by connecting with people who are donors, with people, with companies that have a shared vision to bring healthcare to people who are, we'll call them underserved, for lack of a better term, or maybe undereducated or underemployed, I don't know, under something, compared to people that have great insurance with low copays, low deductibles, if that exists anymore. And so you guys really need that collaborative effort from lots of people to make this possible. And I'd like you to just kind of share that need and that vision.
Yeah, the reality is that healthcare is very expensive. And, so when we look at our bottom line, we talk about in terms of our, what we call our payer mix. So we know that we're going to receive a certain amount from our federal government grant, our state grant, our local. We have local grants that we receive from the city of Denver. And then there's still a gap, because when you have such a high percentage of uninsured, right now our percentage of uninsured is right around 60%, which is the highest of all the health centers in the state. And so there's a significant gap that we have to fill. And that speaks to, I think, what you're pointing to is in terms of support, from philanthropic support from corporate donors, from individual donors. You participated in our fundraising events. We have another event coming up in a couple of weeks, which is our big gala that we're going to be doing downtown. So it takes all of those different revenue streams to make it work. And but it's a huge challenge.
It's well worth it. I mean, can you share? Maybe, I don't know. With you at the CEO, I don't know how many of these stories trickle up to you. But is there any story that comes to your mind of someone who got a service or a procedure that there's no way that they could have gotten had it not been for you guys, and how that impacted their life?
So I think back when we opened up our pharmacy not too long ago, so we had a patient that came to us, a new patient. She was in the 3rd trimester of her pregnancy. She had gestational diabetes, and she also was dealing with severe asthma. Her inhaler, she had a prescription that she had received from another provider, but it was going to cost her about $500 a month to fill that inhaler prescription. And it was to the point where she shared with our provider that she was afraid to leave her home because she thought that if I have an asthma attack, it's going to impact my pregnancy. And so she came here as a new patient. Was seen by one of our providers. The provider wrote her prescription for that inhaler that she needed, walked across the hall to our pharmacy and filled that prescription for $5.
Wow.
So that, that's transformational in terms of the impact on the person's quality of life and the life of her young family.
Unbelievable, man. Well, thank you for that. I appreciate it. And as you're moving forward now, what's next for Tepeyac? What is it that you see as you're leading this group, this organization into the future? Where do you see it going?
I think we're going to continue with what we've done historically, which is to get out in the community and really focus on preventive health education. We're
screenings, that kind of thing.
Doing a lot of that now, doing a lot of the health fairs that are out there. But again, just I think that is really what when we were founded 30 years ago, it was really focusing on preventive health education. And then now we're in a position to do both and do both well, to do the preventive health education and then have a high quality facility where patients can come and get the full spectrum of their health needs met. So so we still have opportunities for growth. We still have our other clinical facility that we renovated and reopened about 3 months ago. I shared with you earlier that we're able to provide screening for people who are who are refugees that need to get medically screened for their mental health and oral health. So we're able to do that, provide that service at our other facility, and we haven't fully operationalized that facility. So there's room for us to expand in that space as well. So, but I see us continuing to grow and serving a more and more diverse population of patients.
Well, you are hitting the target dead center, my friend. This has been a really great, just a really great example of people with a vision sticking to it. I was just listening to a podcast this morning, actually, from a guy named John Maxwell. He's big in leadership space, and he talked about the big five. And basically the big five is, first you got to know the goal that you're chasing. What are you looking to do? Then you got to make sure that you have the tools and that those tools are functioning. Mm-hmm. And then you got to take action, and then you got to be focused, and then you got to have commitment to do something about it every single day. And when I think about what I heard this morning in that lesson and the lesson I'm learning right now from you, you've exhibited all five of those things, you and this team that has built this from day one, where you stayed focused and you stayed committed to the vision. And so, man, just again, great work. We're proud to support you. We think the world of you at Ramos Law and what you guys are doing and the difference that you're making in the community. And man, I wish you nothing but the best as you go forward. Is there any final comments or things that you'd like to say about Tepeyac? Here's what I want you to address. How can people get involved? If someone wanted to help and help this thing see its vision and take it to the next level, what does that look like?
Yeah, we do have volunteer opportunities for especially specialty care providers. That's an area that that continues to be a challenge. Making sure that we have when a patient needs a referral for some type of very critical specialty care. We do offer several different specialty care options here at the clinic, but there's some that we don't offer. So we have, for example, we just brought in a volunteer wound care specialist.
And it came on site, and then you would just announce that wound care was happening on this day, book your appointments, kind of thing.
Correct.
Got it.
And so, so there's those type of very specific type of volunteer opportunities. We have our events that are a lot of work. It's always great when you have outside organizations that can step in and help put on some of those events. So yeah, I think there's always an opportunity to help.
I'm sure you take donations.
I always take donations. Yeah.
How would people find you if they wanted to donate?
TepeyacCommunityHealth.org. So I think go to our website. There's a lot of information there. Opportunities to volunteer. It helps if you're bilingual. We have a lot of Spanish-speaking families. So, but yeah,
that would help too.
We're always looking for people that are like-minded and want to help.
So good. And if you're watching, you can see in the banner behind us, it's Tepeyac. You can see that. But if you're listening, again, Tepeyac. Go to the website, see what you can do to be involved, because it does make a difference. It takes all of us, and that's the name of the show, right? Making a difference. It takes all of us to do that. And any way that you find to give back is going to make that difference. So now as we wind it up, I want to say thank you guys for joining us. And if you are watching this, please hit the notification button, the bell that you'll get to notice when more episodes are coming out. If you're on Apple or Spotify listening to it, please give us the 5-star thumbs up, love it, whatever, cool emojis. And most importantly, share this with people who need to hear it, right? We do so many different shows on so many different topics. Not every topic is for every person, but when you find one that connects with your heart and your soul, please share it with others who might basically benefit from it as well, because that helps us with our mission on this show of making a difference. So I appreciate you very much. And until next time, keep making a difference.